Hi, good evening, and welcome to this histology slide discussion session. This is the third week of our histology slide discussion, and as some of you had asked, let's try to understand few slides of the nervous system today. And uh, I will not disclose what slides we'll be discussing. Probably will just ask some of you to identify the slide first, and then we'll discuss what slide are we seeing and how to differentiate between the similar kind of tissue, right? So can you just try and identify this slide? What exactly is the slide that we are actually seeing now? Uh, this is the slide of spinal ganglion, right? Now, let's try and understand why exactly this is the slide of the spinal ganglion. So first we will write it down. So this is the side of spinal ganglion. And what is the other name for it? We also call this as the sensory ganglion. Now, how do we identify this and how do we differentiate the sensory ganglion from this slide, right? We will try to understand. So the first thing, how do I say that this is the slide of the spinal ganglion? The first thing I want you to understand here is what do we mean by ganglion? Remember, ganglion refers to collection of what structures? Collection of the cell bodies of neurons, right? Where cell bodies of neurons in the peripheral nervous system. What do you call the collection of neurons inside the central nervous system? You call it as gray matter. You call it as nucleus. You call it as columns, right? So whenever only cell bodies of a neuron form an aggregation in the peripheral nervous system, we refer it to as ganglion. And ganglion are of two major types. One is sensory ganglion, which is also referred to as the dorsal root ganglion. Are we clear? Now, how do I identify this as the dorsal root ganglion? Remember, the characteristic feature of this ganglion begins with identification of the collection of round or oval shaped cell bodies, right? Oval shaped cell bodies of pseudo unipolar neurons, right? Now, how do you find this collection? Remember, this is always found in groups. We will see the next slide. You will understand it a lot better. So the one that I just marked is a cell body. Now this is a cell body. This is a cell body, right? All these are only cell bodies, and how they appear? They appear either round or oval, and they are always found in groups. They're not scattered, right? Then the next important feature is I want you to take a look at this important feature. Now, what is this? Remember, this is the central nucleus, right? This is the central nucleus. Central nucleus in a round shaped cell body of a neuron is the typical feature of the sensory ganglion or dorsal root ganglion. Apart from this, we can identify a thick capsule, right? So this is the thick connective tissue capsule surrounding the entire ganglion. So how do I identify the pseudounipolar neurons, or how do I identify the dorsal root ganglion? Remember, groups of round to oval shaped cell bodies found with a central nucleus. The entire tissue is covered by a thick connective tissue capsule. We can see minimal fibers separating the cell bodies of the neurons, right? Then, if we closely observe, we can see few cells here. This is one, this is one, All these cells that we see here, now these cells are what we call as the satellite cells, right? Now, these satellite cells are found in plenty, right? Now, what are these satellite cells? Imagine we have, this is the cell body of a neuron, right? This is how it looks. And it has the central nucleus with a prominent nucleolus, right? The cell body is in turn covered by one more flattened type of cell surrounding it from the periphery. Now, these are what we call as the satellite cells, and these have their own nucleus, right? This is how the typical appearance of a pseudo-unipolar neuron cell body with satellite cells will look. Now, let's for a moment take a look at this slide. Now, what is this slide? This slide is the slide of the autonomic ganglion. Fine. Autonomic ganglion, you can call it as sympathetic ganglion. This is the slide of the autonomic ganglion. Now, what is the striking difference between the two you will see here? The first thing that we observe is the cell bodies are scattered, right? So you see one here, you see one here, you see, right? So they're not present in close aggregation or close groups. This is the first and the most striking difference that we need to see. Okay, so cell bodies scattered. Now these cell bodies appear smaller, right? And if we closely observe, we can see projections arising from them. See, they have spine-like extensions. Why? Because these are multipolar neurons. Then the next characteristic feature is, I want you to take a look at the position of the nucleus. Fine. Take a look at this. Take a look at this, even this. What is the characteristic position of the nucleus? So remember here, the nucleus, right? The nucleus is eccentric. Done. So scattered, smaller, multipolar neuron cell bodies with eccentric nucleus is the feature of the autonomic ganglion. The autonomic ganglion looks exactly like this. This is how the cell body looks. We have the central nucleus. Surrounding this, we have few satellite cells with their nucleus, right? So what is the characteristic feature again? So remember, small scattered neurons with eccentric nucleus and very few satellite cells, right? So this is how we should identify between the dorsal root ganglion and autonomic ganglion. Fine. So let's try and compare the two again. Here is the slide of the spinal ganglion, right? How do we identify the spinal ganglion? The spinal ganglion has the collection of cell bodies of round to oval shaped neurons with central nucleus and a prominent nucleolus, right? Then it is covered by a thick connective tissue capsule. The amount of nerve fibers separating the cell body is very less. Whereas when we see the section of autonomic ganglion, we see small multipolar neurons with a spiky projection or appearance because of their multipolar neurons. The characteristic position of the nucleus is eccentric, right? Done. The second important difference I want you to identify here is we have more number of satellite cells, right? So here we have more number of satellite cells. And when we talk of autonomic ganglion, the satellite cells are very few, right? So this is how we need to differentiate between the two ganglion. Hope it is clear, right? Now what we'll do is, will quickly try to summarize, right, the difference between the two. Okay, so let's write the features on one side, and here let's talk about the spinal or the sensory ganglion, and here we'll talk about the sympathetic ganglion. Fine. Now, first, what type of neurons do we get? The spinal ganglion or sensory ganglion, this contains pseudo-unipolar neurons, right? Pseudo-unipolar neurons, and here it is multipolar. This is the first and the most striking difference. The second thing, what is the shape of cell body, right? So cell body is, here it is round to oval, whereas here it has spike-like projections. And why spike-like projections? This is because of multipolarity. Then, what about the size? Here it is small. The spinal ganglion, the cell bodies are large. Here it is small. What about nucleus? Right? So remember, nucleus is central, and here it is eccentric. Right? The last important difference. What about satellite cells? Right? So satellite cells, here it is more, here it is few. Now there is a simple question. Why we get more satellite cells in spinal ganglion, and why do we get fewer satellite cells in the autonomic ganglion? If you want to answer this, you must know what is the function of satellite cell. Remember, satellite cells form the important supporting cells, as well as they provide nutrition or nourishment to the entire cell body of the neuron. Now, in which of these types of neurons we get larger cell body? Yes, it is in the spinal ganglion, which are pseudounipolar. So imagine you have a larger body, you need more nutrition, and this can be supplemented only by satellite cells. So the number of satellite cells in sensory ganglion is more. Whereas when we talk about the autonomic ganglion, we just saw that the cell body is very small. Now you have a smaller body, you will require less nutrition. So naturally you will have smaller or fewer satellite cells. Fine. Now this is one important Viva question you can expect in your slide discussion. What are satellite cells? What is its function? Right? And why satellite cells are more in number in spinal ganglion. Okay. If you get the slide of spinal ganglion, if you get the slide of autonomic ganglion, you will definitely get this question by your examiner. Done? Right? So this is regarding a brief discussion on the differentiation between the spinal ganglion and the autonomic ganglion. Done? Now, I'll just quickly close it with a quick revision. Spinal ganglion is also called as dorsal root ganglion, or also called as sensory ganglion, identified by the presence of groups of large round to oval cell bodies of pseudounipolar neurons. In these neurons, the nucleus is central in position. There is large number of satellite cells. The whole tissue is covered by a thick connective tissue capsule. Autonomic ganglion is identified by the presence of smaller polygonal neurons with spike-like projections, and these neurons typically have an eccentric nucleus, fewer satellite cells, and the cell bodies are separated by wide or large bundles of nerve fibers. Fine. We have summarized the differences, and this could also come as an important 3-marker question for your exam. We also discussed about one important Viva question that they can ask: why satellite cells exist, and why they are more in number in spinal ganglia. Right? So this is a quick revision of the two very commonly confused slides in nervous tissue. Fine. Some of you had asked last time that we should discuss about these two slides. So we have discussed about the two important slides where we often get confused, which is spinal, which is sympathetic. Fine. Hope this is a lot clear now. Right. If there are any doubts related to whatever we have discussed till now, please let me know. So that I'll clear it before we close. Fine. If there are no doubts with respect to this session, uh, do let me know what slides we should take up for next discussion. And we shall see again two contrasting slides, which are like difficult to differentiate and identify. And we will discuss the same slides. Right? So do let me know, and we shall discuss the same for your next week. Right? Thank you. Thank you for joining.
Recording stopped.